Hello YouTube and welcome back to the channel. In today's video I'm going to go through a battery of stretches that you can use if you have a sore knee. I've come back, I've just rehabbed myself back through a medial meniscus tear on my knee, and when I'm running I have a little bit of stiffness and a little bit of tightness in the knee. Overall pretty good, it just needs a little bit of stretching. So here's just a couple of stretches that I do before I head out for a run to alleviate any sort of pain, tightness and tension in that left knee. Okay, so we can't stretch out the knee joint per se because we don't stretch joints. What we can do is we can stretch all the muscles that cross the joint. So for me it's going to be mainly the quadriceps, hamstrings, adductors, the tensor fasciae latae or the iliotibial band running down the back of the knee, and then of course the calf muscle which crosses the knee. So to start off it, I'm just going to stand on the sideline so you can see what the angle looks like. I'm just going to take up that left knee, the symptomatic knee, and I'm going to just pull that heel in towards my backside, and that's just going to get a straightforward quad stretch. So I'm just going to hold that there for about 10 or 15 seconds, and I'm going to run through quite a few stretches. I'm just going to hold them all for about 10 or 15 seconds. As I hold it, try and breathe in through my nose, out through my mouth, and then relax. So I'll drop that down, and then from there I'm just going to have my hands on my hips. I'm going to step out with my right leg, and I'm going to drop down. I'm going to feel that stretch on the inside of that left groin, so I'm really stretching into that adductor muscle which crosses the knee joint on the medial side, which is of course where I'm feeling that bit of stiffness and tension. So I'm just going to hold that there for a couple of seconds. Again, big deep breaths in through the nose and out through the mouth. Just holding that there, nice and easy. And then from there, I'm just going to come up. Go to stand this way, I'm just going to flex it down. I'm just going to reach it down towards the ground. So now I'm feeling the stretch coming down through the back of the hamstrings in both legs. Hold it there for a couple of seconds. I'll come back up. And now I'll go straight back down. I'll hold it down again for a couple of seconds. So I'll get a little bit further the second time. I can really feel that stretch now in my hamstrings at the back. It's not affecting the part of the knee that feels stiff or tight, but it's definitely getting a bit of a stretch across the posterior aspect of that left knee, which is exactly what I want. Good, and I'll come up from there. I'm gonna go lateral now, so what I'm gonna do is I'm gonna stand, I'm gonna keep my left leg straight, I'm gonna step across my left leg with my right leg. So I'm gonna keep the symptomatic leg straight. I'm gonna step across with the right leg. From there, I'm gonna push my hips down towards the wall that I'm holding onto for balance. Push the hips in, and then I'll just lean over this way. And when I do that, I really feel that stretch just on the top of that tensor fasciae latae muscle, which is the origin of that iliotibial band. So let's get a good stretch across that IT band. Trying to keep the foot flat on the floor. As I do that, I can really feel that stretch coming down the lateral aspect of my left thigh, and I'm feeling a little bit of compression on the medial aspect of my knee. That's all fine because I know then that I'm getting a bit of a reaction. So I'll just come up from there. From there, I'll turn and face the wall. What I'm going to do this time is just bring that left leg back. I'm going to push the heel down into the ground, and I'm going to lean in towards the wall. So as you can see, I'm really got my left knee is locked out. My right knee is pushing in towards the wall. My left heel is pushing down towards the ground, and I really feel a stretch in that calf muscle. So that muscle crosses the knee joint, so it's very important to stretch that calf. I'm just going to hold that there. Big deep breaths in through the nose and out through the mouth. And then from there, I'm just going to ease my way back away from the wall. Okay, and then I'm going to bend both knees this time. So I'm going to bend that left back knee. So now I'm stretching the soleus muscle, which doesn't cross the knee, but it's still important to stretch that because this is part of the calf complex. So we'll just hold that there for a couple of seconds. That's it. And then come up from there. And then I'll just finish one more time with the quad stretch. I like to just finish off on that quad stretch again. And now it feels a good bit easier. So my main tightness is going across the anterior, the front aspect of that knee. So going around after doing those stretches on each of those large muscle groups, it definitely feels a little bit easier now, and I can really start to pull my heel into my backside, and that puts quite a bit of tension across the knee, but there's not any pain. There is a good bit of tension, but there's almost zero pain. All that there. And relax. I'm going to go around and do those exercises again. I'm going to do a second set on that knee. I'll also do, before I do that second set, I'll do a whole set on the right knee as well. I always like to keep things balanced. Whatever I do on the left, I try and do on the right as well. If I'm doing 2 sets on the left, I might just do 1 on the right. It doesn't really matter, but I think it's always important to do both sides. That's pretty much it for those. I hope you enjoyed those stretches. Hope you get a little bit of relief if you have a sore knee. Any questions, pop them below, and if you like this video, make sure you hit it a like. Take it easy, guys. Remember, run far, run fast, and most of all, run sensible.